You have been incredibly diligent with your health. You make sure to go to your annual checkups every single year without fail. You get the standard blood work done just like you are supposed to. And every single year, the message you get from the doctor is exactly the same. They tell you, your labs look great. Everything is normal. We will see you next year. You walk out of the office, but that nagging feeling inside you remains. It is that sense that while you might not be sick according to the medical standards, you certainly do not feel like you are thriving or living your best life. What if I were to tell you that normal is often just a waiting room for disease? What if I told you that the true signs of your future health are being missed? I am talking about the early warning signs of heart disease, the signs that your metabolism is slowing down, and the signs that your organs are under stress. These are often completely overlooked in that standard yearly physical exam. The reality of the situation is that the standard blood panels ordered by most primary care physicians are designed for one thing. They are designed to catch diseases after they have already caused a significant amount of damage. They are reactive, which means they react to a problem rather than being proactive. They are looking for a heart attack, not the 10 years of silent plaque buildup that happens before it. They are looking for liver failure, not the early stress that steals your energy away day by day. If you want to take back your vitality rather than just managing a slow decline as you get older, you need to look deeper. Today, we are going to bridge that gap together. We are going to walk through 5 specific, critical blood tests that go far beyond the standard panel you are used to. These are the tests that can reveal the silent dysfunction happening in your arteries, in your brain, and in your metabolism long before they become a crisis. And I invite you to stay with me until we reach the very end of this video. We are going to start with some foundational insights that will redefine how you see your organs. But we are building toward revelation number 1. This is a specific heart health marker that is determined by your genetics. It is incredibly dangerous, and yet it is rarely ever checked. Uncovering this single number could quite literally save your life. Before we dive into all the details, if you believe that your health is an investment that is worth protecting, please go ahead and join our community. You can join us simply by hitting that subscribe button. We are a group of proactive seniors who are refusing to settle for average, and I have just a quick, important reminder to share before we begin. All the information I am sharing with you today is for educational purposes only. Everyone has a health situation that is unique to them. So please make sure you consult your doctor or your healthcare provider before you make any significant changes to your diet, your exercise routine, or your health regimen. This is especially important if you have pre-existing conditions or if you are currently taking medication. Let us use this knowledge to have informed discussions with them. Now, let us unlock the data that your body has been trying to show you. Insight number 5, the true kidney sentinel. We are starting our list with a vital insight into how your body filters out toxins. You have likely had your kidney function checked before. Doctors use a marker called creatinine to do this. It is included on every standard metabolic panel, and for many decades it has been considered the gold standard. However, there is a significant flaw with relying only on creatinine, specifically for those of us who are in our prime years. You see, creatinine is a byproduct that comes from muscle breakdown. This means the result of the test is heavily influenced by how much muscle mass you currently have on your body. As we age, it is completely natural to experience some muscle loss. This is a process known as sarcopenia. Consequently, if you have lower muscle mass, your creatinine levels might look deceptively low. A doctor might look at that normal or low number and assume that your kidneys are filtering perfectly. In reality, your kidneys might be struggling to filter toxins. But because there is not enough muscle breakdown happening to raise the alarm on the test, the standard screening misses the problem completely. To truly understand this, I want you to imagine a car. Imagine your car's fuel gauge is broken and it is stuck pointing to full. You could be driving around town with an empty tank. You could be dangerously close to a breakdown on the side of the road. But because the gauge says full, you never stop for gas. Creatinine is that faulty gauge for many seniors. It gives you a false sense of security. This is where our insight number 5 comes in. It is a test called Cystatin C. Unlike creatinine, Cystatin C is not affected by your muscle mass or by your diet. It is produced by every single cell in your body at a steady rate. It does not matter if you are a bodybuilder or someone who prefers a gentle walk in the park. It gives you a pure, unclouded look at how well your kidneys are actually filtering your blood. By asking your doctor for a Cystatin C test alongside your standard labs, you are essentially fixing the fuel gauge in your car. You get the real picture of what is happening. This is crucial because kidney decline is often silent until it is very advanced. Catching it early with Cystatin C allows you to hydrate better, adjust your diet, and protect those vital organs before permanent damage sets in. It is a simple switch that provides profound clarity. Strategy number 4, the silent liver ledger. Moving deeper into our metabolic health, we arrive at a test that you have almost certainly taken before. However, it is one that is consistently misinterpreted in a way that could be harming you. This is the ALT test, which is a marker for liver health. If you look at your lab report right now, it will likely say that an ALT level up to 40 is normal. You see that number, your doctor sees that number, and usually the conversation ends right there. But we have to ask a very important question: where did this normal range come from? Laboratories determine normal by taking the average of the population. The issue is that the average population has been getting progressively less healthy over the last few decades. With the rise of processed foods and environmental factors, nearly a third of the global population now has some form of fatty liver disease. This means that when the lab tells you that 40 is normal, they are essentially grading on a curve where the whole class is failing. Being average in a sick population does not mean that you are healthy. Think of it like a structural safety inspection for a bridge. If the inspector says, well, it has fewer cracks than the bridge down the road that just collapsed, that does not make it safe. It just makes it less broken than the worst-case scenario. We do not want less broken, we want structurally sound. Strategy number 4 is to look at your ALT through a lens of longevity, not just through the lens of being average. Functional health experts and updated guidelines suggest that a truly healthy liver should have a different number. A liver that is not struggling with silent inflammation or fat accumulation should have an ALT level much lower. We ideally want to see this number below 25. Why does this matter so much? Your liver is your primary detoxification center. If it is sluggish or inflamed, which is indicated by that high normal ALT, it affects everything else. It affects your energy, your blood sugar, and your hormone balance. By aiming for an optimal level rather than just a normal one, you are ensuring your body's filtration plant is running at peak efficiency. This keeps your blood clean and your energy high. Secret number 3, the metabolic alarm bell. Now, let us uncover a secret that might surprise you. When you hear the words uric acid, what is the first thing that comes to your mind? Likely it is gout. You probably think of a painful, swollen toe that keeps you up at night. However, limiting uric acid to just being a marker for gout is a massive oversight. High uric acid is actually one of the earliest, loudest warning bells for metabolic disaster. Specifically, it warns us about insulin resistance and high blood pressure. You see, uric acid is not just a passive waste product that sits there. It is biologically active. High levels can actually cause oxidative stress inside your cells and damage the lining of your blood vessels. So then, ignoring your uric acid levels just because you do not have joint pain is a dangerous game to play. It is like ignoring smoke in your house because you do not see flames yet. The smoke is the warning. High uric acid is the smoke that signals a metabolic fire is smoldering somewhere. Usually, this is in the form of insulin resistance, and it happens long before your blood sugar tests show you are pre-diabetic. To visualize this, I want you to imagine your metabolism is a finely tuned engine. Uric acid is like the grit and sludge that builds up in the oil. If there is too much sludge, the engine starts to overheat and grind. It creates friction. That friction represents high blood pressure. That overheating represents inflammation. Secret number 3 is to monitor your uric acid as a broad metabolic marker, not just a joint pain marker. While standard labs might say anything under 7 is fine because that is the cutoff for gout, for metabolic protection, we want to be much more aggressive. We ideally want to see levels closer to 5.5. Reaching this optimal level can be a game changer for your health. It often involves tweaking your diet to reduce fructose, which is sugar, and alcohol. These are major drivers of uric acid. By keeping this number in check, you are not just saving your toes. You are protecting your arteries and your body's ability to handle sugar. It is a powerful lever for overall health that most people never even touch. Key number 2, the vital brain and heart shield. As we approach the top of our list, we turn to a marker that is intimately connected to the health of your brain and your heart. Yet, it is rarely checked in routine physicals. This marker is homocysteine. Homocysteine is an amino acid. It is a natural byproduct of protein digestion. It is normal to have some of it in your system. Yet, the situation changes when your body cannot recycle it effectively. When levels get too high, homocysteine becomes toxic. It scrapes and damages the lining of your arteries. This creates rough spots where plaque can stick. Even more concerning for us as we age, high levels are strongly linked to brain atrophy and an increased risk of dementia. Thus, knowing your homocysteine level is non-negotiable for anyone over the age of 60 who is concerned about preserving their memory and their vascular health. Here is the best way to understand this. Think of your body like a busy factory. Homocysteine is the exhaust smoke produced by the factory machines. A well-designed factory has a powerful ventilation system to handle this. That system is your B vitamins, specifically B12, B6, and folate. This system sucks that smoke out and converts it into fresh air or useful materials. If you are deficient in these B vitamins, which is very common in seniors due to absorption issues, the system fails. Or, if you have a genetic variation like MTHFR that affects how you process nutrients, that ventilation system breaks down. The smoke, which is the homocysteine, builds up inside the factory. It starts choking the workers and corroding the machinery. Key number 2 is to demand a homocysteine test. If your levels are high, which is typically above 10, it is a clear signal that your ventilation system needs support. The beauty of this marker is that it is often actionable. It might mean you need to supplement with methylated B vitamins to help clear that exhaust out. Lowering your homocysteine is like opening all the windows in that factory. Suddenly, the air clears, the toxicity drops, and your brain and heart can function in a clean, safe environment. It is one of the most proactive steps you can take to shield your cognitive future. Revelation number 1, the ultimate cardiovascular truth. We have arrived at the most critical point of our journey today. This is the finale of the 5 hidden blood tests. It centers on the number 1 killer of men and women, which is heart disease. For decades, you have been trained to look at one number. That number is LDL, the so-called bad cholesterol. You get your report, you see the LDL number, and you think you know your risk. But relying solely on LDL is like trying to predict a traffic jam by weighing the cars on the highway. A few giant semi-trucks might weigh the same as 100 motorcycles. But it is the motorcycles that cause the congestion. In your arteries, it is the number of particles that drives plaque into the vessel wall, not just the total cholesterol weight. Furthermore, standard panels completely miss a genetic supervillain particle that affects 1 in 5 people. Therefore, to truly unmask your heart risk, we need to upgrade to revelation number 1, This is the combination of ApoB and LPA. Let us break this down because this is the information that saves lives. First, let's talk about ApoB or apolipoprotein B. This is the superior cholesterol test. Unlike LDL, which estimates risk, ApoB counts every single dangerous particle in your blood. It captures the small, dense particles that standard tests miss. These are the ones that are most likely to get stuck in your artery walls. If you have insulin resistance or belly fat, your LDL might look normal while your ApoB is skyrocketing. Checking ApoB is like having a high-definition camera on that highway. You see every single car and you know exactly how bad the traffic is. Second, and perhaps even more vital, is LPA, or lipoprotein A. Think of LPA as a highly dangerous cousin of LDL. Imagine a cholesterol particle, but it is wrapped in a sticky Velcro-like coating. This particle does not just deposit plaque, it promotes clotting. It is a double threat. Here is the kicker. LPA levels are almost entirely genetic. You could run marathons and eat kale every day and still have dangerously high LPA if you inherited the gene. Standard cholesterol drugs often do not touch it. If you have a family history of early heart attacks, like a grandfather who passed at 50 or an uncle with a stent at 45, high LPA is the prime suspect. Yet, most doctors never check it. Revelation number 1 is realizing that you need to check LPA at least once in your life to know your genetic baseline. And you need to track ApoB to know your dynamic risk. By knowing these numbers, you are no longer jumping out of a plane and hoping your parachute opens at the last second. That is what the standard 10-year risk assessment is. Instead, you are pulling the ripcord early. You are identifying the risk while there is still time to intervene aggressively. This can be done through lifestyle, targeted supplements, or medication. This is the difference between hoping for heart health and verifying it. And there you have it. That is our game-changing revelation number 1. It might seem daunting to realize how much the standard tests miss, but this knowledge is power. It is the power to turn the lights on in a dark room. So, we have covered a lot of ground today. We started with insight number 5, the Cystatin C test for true kidney health. We moved to strategy number 4, rethinking your ALT for a clean liver. We uncovered secret number 3, using uric acid as a metabolic smoke alarm. We discussed key number 2, checking homocysteine to protect your brain. And finally, we unveiled revelation number 1, the ApoB and LPA tests that provide the ultimate truth about your heart. Each one of these is a stepping stone to a more vibrant, healthier you. Which of these insights resonated with you the most? Are you curious about your genetic risk with LPA? Or maybe you are realizing it is time to check that metabolic smoke alarm with uric acid. I would love to hear your thoughts, so please share them in the comments below. If you found this journey through these health discoveries valuable, please give this video a thumbs up. It really helps others find our community. And do not forget to subscribe and hit that notification bell for more powerful strategies tailored for our fantastic group of healthy seniors. Until next time, stay healthy, stay curious, and keep thriving.